So yeah, today actually my plan was to just keep this very casual and to just go with the flow and just to share with you guys some of my research and what I uncovered, especially because I think right now, this, I guess, field of study of non-locality and non-local healing is becoming more and more predominant, which was the focus of my study. And so I actually chose to do it on this just because I myself have worked in the field of non locality um, and worked on and really studied, that concept of we can heal even when time or space is separating us, and how does that happen, how is that able to happen? And that's when I was like, okay, it would be wonderful if I could create a study where I could prove the efficacy of non-local healing, where I could prove that it's effective, because I think so many people still will write it off as a placebo effect, or just discredit it and say it's woohoo or whatever people want to say about it. But I had been working with it for years, and whether people were skeptics or not, people were getting results. And so even people who would come into my practice who were, we'll call them non-believers, maybe their daughter or their wife encouraged them to come see me, would then afterwards be believers because of the results that came through. And so that was my study, is I wanted to show that it's effective at assisting in pain, as well as emotions with illness, mental illness, especially stress, because those tend to be the two most often ones that I would see come into my clinic and people who would work with me. And it was such a beautiful way for any practitioner to be able to work with people all over the world. So you're no longer limited, especially for people who live in small towns, who maybe live in areas where there isn't a practitioner who's close to them. It's now, there's no longer that limit of who's around you. You literally have the entire world to find what practitioner resonates with you, and then being able to work with that person rather than having to try to find somebody in your local area. And so the research that came through, and I'll just share my screen here just to walk through the actual, wrong one. Where'd it go? Of course it disappears. Just give me a moment. There we go. So this right here is, I'll just actually walk you through a few parts of my paper. And one of the biggest things was the effect that mental health and chronic pain has on our world. It is a huge issue, both of those things. Pretty much everybody is affected, whether it's personally or through someone you know. And then we're all affected at, I guess we'll call it like an economical level, because when people, especially for something like chronic pain, there's a lot of resources that goes to supporting people who aren't able to cope or function because of the pain. The actual treatments are very, very limited right now through traditional allopathic medicine. As far as medications go and surgeries, a lot of them are symptom-based solutions, which have a lot of side effects, potentials for addiction, bad reactions, and none of them really, for both of them, often get to the actual root of the issue. Usually it's more of, okay, what's the chemical imbalance in the body, or what's a way that we can alter the chemicals of the body to deal with the symptoms, but not actually finding and getting to that root of why did this come about in the first place. And that's where really working with non-local healing, you're always working with that upper level of existence, that supramental level, that soul level, where we know from the downward causation model is where most healing begins. True lasting healing starts at that level and then eventually trickles down to the physical body. And so there's nothing wrong with physical body medicines and working with vital medicines and mental medicines. I think if we combine all of them at once, then we get a really holistic, integrative picture. But if we only work on that lower level, as you all know, and we don't go up into that energetic root, and then it's always going to be a temporary band-aid solution, and it's never really going to actually give you that long-lasting result. And I really was fascinated by the idea that two people could live the same lifestyle, be the same age, be the same weight, but one could have a huge list of problems and one wouldn't. It's like, what's the difference between those two people? When physical medicine can't determine that, where's that coming from? And that's where I really feel the study of non-locality and the study of working with that energy body, which transcends time and space, isn't confined to physical. That's where we really get into those deeper roots, especially when people are dealing with something that is unexplained, where it's like, they've seen many doctors and seen many practitioners and no one can really figure out what's going on. Usually that's where we find those roots. And so, with chronic pain as well, there is a link to mental illness. And so that is where I guess the tangled hierarchy of all of this comes into it, is that it's either one of two ways. If you're in pain, you're probably uncomfortable. When you're uncomfortable, you're probably not going to feel your best. And when you don't feel your best, your energy becomes weak because our mental body affects our vital body. And so then the meridian centers aren't flowing as effectively, which then only exacerbates the physical pain, creating that tangled heart hierarchy of problems. Or vice versa, if you're not feeling very good, if you're dealing with chronic anxiety, chronic stress, depression, then we know directly that will affect our vital body, which then correlates into the coagulation patterns in our blood, which then affects our entire body's ability to heal. And so the same thing happens is then often people are dealing with chronic stress or depression or any other mental illness. It's eventually what ends up happening is that the physical body can get depleted and then other physical problems can manifest, which then only then plays into the mental illness. And it's where we have this almost this cycle of illness that can be very hard to break when we're only looking at the person who's coming, the patient, from one perspective, from a physical body that needs a physical solution. You're missing that whole downward causation and that ability to break that loop. And so that's where I feel like this studies really comes into play in all of the work we do, no matter what kind of work we do in that field of integrative medicine. It's all about looking at the patient as a whole, is not just seeing it at any one level. It's not just a consciousness or a mental. It's not just a physical body. It's not just an energy center. It's all of it at once. And so if we can find a way to work with other practitioners to support all of those levels at once, then we have the ability to create quick healing through that symptom, that physical body, that vital body medicine that will give you the instantaneous results, as well as the long-term healing by working at that mental and supramental level. So in my paper here, I went over a lot of different modalities and how it relates to healing and non-local healing and energy healing, looking at Ayurvedic medicine, which I really feel works actually with many different layers of it. Works with the physical because it brings in that balancing through herbology, nutrition, but it also, Ayurvedic medicine acknowledges the mental aspects, the emotional aspects, and how we can balance our emotions through balancing the elements through using herbology, using even our lifestyle changes. Being mindful of, what reacts with our energy, for somebody who has, for example, the Pitta type, because it's right there, which is the fire type, is understanding how to eat for that, to balance that fire, that heat, that passion within, how to be mindful emotionally that when out of balance, the Pittas can become a little bit more aggressive, a little bit more angry because of that passion, and how then you can create a lifestyle and environment to nurture that. And so I really feel like a lot of the modalities actually encompass many of them at once. Even Chinese medicine, same thing. It does present itself often as a vital body medicine, working mostly with the meridians, but there is that herbology and that nutrition aspect as well as the acknowledgement of what element you are as far as the emotions go and how you can honor that, which is very beautiful. But getting into I'll go to the actual study part of what my study was. was actually using a device called the SKIO. For those of you who aren't familiar with it, it is a type of biofeedback device, but I was actually using it non locally, which is not often how it is used, but it very much can be used that way. And so this is actually just reviewing biofeedback and the efficacy of biofeedback for mental health. And this was another study that was conducted. Not this wasn't the one I conducted, that really showed significant improvement in stress levels from people who were receiving biofeedback. Same thing as well. They did control groups for pain as well, and all of them showed that they were very significant at supporting that reduction of pain and stress in the body. That is obviously more in person, but when we take that same concept and we take it in a non-local aspect, that's usually where people then can get a little bit like confused. It always makes sense when your body's attached to the machine. It's like, oh yes, I'm touching it, and so the electrical pulses are going into my body, and it's comprehensible. So how does it work without that physical aspect? And this is where, coming into that very supramental level, that supramental understanding, I'm just going to stop sharing my screen so I can see you guys a little bit bigger for a second, is really coming into that concept of quantum entanglement. Is the best way I can explain how it works, is that whole idea that we are all connected through the quantum fields. Everything's connected. And even if our modern technology can't maybe fully zone in on that quantum field and what that looks like, it's been proven time and time again as we've been able to interact with that quantum field, that connection, how they've been able to see that two quantum particles, one could be here where I am in Canada and another could be in Africa, and yet interact as if they are one. So if one's spinning this way, you could literally stop the one right here in Canada, and simultaneously, instantly, that one stops in Africa. And it's not at the speed of light, it's instantaneous, which says it's not a signal. It's not saying, oh, this stopped, okay, you stop too. It's an actual physical oneness despite separation. And so when we bring that concept into healing, whether you're working with your own energy, like Reiki, or you're working, excuse me, with a device like the one I'm working with, what it's doing is it's creating that entanglement through intention. It's using the consciousness and the energy of that device or that person to create an entanglement through saying that, yes, I would like to receive healing. Instantly, we know there's already been a quantum collapse. As we know it through our studies, you're collapsing a potentiality in those waves of potential, opening it up, saying, yes, I would like to receive healing. It's almost like opening a channel through the quantum field. And then for the device, for example, you put in your name, your birthday, your birth location. I call it your biological phone number, because that's the time and space that your energy moved into this reality. Then the device is saying, okay, I want to connect with this person. And through that collapse, the collapse that the device creates at the simultaneous time, there's a collapse that the person receiving the healing creates. Then there's an entanglement between the two. And the device is able to pull up readings about what's going on in the energy, to show the auric field, to show the chakra centers, and then is able to then send corrections instantaneously. Not the device projects it and eventually it reaches the body. It's literally, as the work is being done on the device, simultaneously the changes are happening in the physical. The same way, if I close my eyes and really drop into a meditative state and ask to connect with one of you, and one of you say, yes, I'm willing to receive healing, something very similar happens between the two of our energies, and I can create intention to create healing within your body. And that is the premise of the entire study I did. Is I basically broke it down. I had 3 groups. I had a placebo group. I had a group, 10 people receiving a treatment with the device non-locally, and 10 people who were receiving an energy healing directly from an energy practitioner. And obviously nobody knew what group they were in. How it was operated was that basically we would check in for a month before. So I would see how they were feeling. There would be 2 first initial calls where we would rate pain from 1 to 10 on average for the previous 2 weeks. We'd rate stress from 1 to 10. We would rate the sleep. We would rate motivation levels, because that's key. So shift, because often our motivation can be defined by, whether we're in a depressive episode or not, as well as certain behaviors. If there was any aggressive outbursts in the last 2 weeks, if there was any difficulties in food patterning, eating habits, insomnia, and it really went over just their basic acknowledgement of where they were at for the last 2 weeks. And then I did that for a month before. And then on the day of their therapy, or their allotted time, if they're in the placebo group, that's what they were told. It was their allotted time. I did a call before just to take all that information, as well as exactly how they were feeling in that moment from 1 to 10. And then directly after 1 hour, I would call them back and do it again. And no one would know what group they were in. They would just ask to be neutral for that time. So don't, meditate and, do anything that's going to obviously encourage results, but, don't put yourself in a stressful situation that's going to also deter. Just to remain neutral and just to just do whatever they needed to do while not putting themselves into any situation that could influence it either way. And yeah, the results were, I knew it was going to be effective, but I was pretty pleasantly surprised by the actual physical results. And I'll share with you again, just one moment, the charts from the research. Let me share this. Here we go. So here is the results initially. So this was I'm just making sure. Can you guys see my screen? Yeah. Okay, perfect. So this was the initial assessment is in blue, and the final assessment's in green. And this is for everybody who was in the SKIO group. And so this is from that very first assessment a month before their one-on-one session, or that allotted time, and then a month after. So this showed the results for 30 days after versus 30 days before. You can see there was a significant reduction in pain, stress, and for the SKIO group particularly was the highest increase in actual motivation levels. So a shift in how they were feeling about their life. A lot of people described just feeling like they had more energy, feeling like, they were more excited about their days. They were having an easier time managing, some of the stuff going on in their life, and also a significant improvement in sleep. And so you can see the figures below. Their motivation increased by 50%. The sleep increased by 30%. The stress reduction was down 20%, and the reduction of pain was down 16%. And that's what lasted over 30 days. And so the results directly after the therapy were actually even more substantial, but we'll get there. The energy healing group, this was their initial assessment versus 30 days after their session. They had the largest reduction in stress out of any group for the actual hands-on energy work. It was actually quite interesting. What I noticed was the group receiving a therapy from the SKIO had the most results directly after their treatment, but the energy healing group had the most results long-term for the 30 days after. And my belief, or I guess my hypothesis, and why this happened was because the SKIO, I believe, very much focuses on that vital level. So giving you that instantaneous increase in energy throughout the internal energy center. So it creates very quick, instantaneous results in the physical and mental bodies because it's really working on those levels, versus the energy healing from the energy practitioner, I really feel was all up at that supramental level. And so it took a few weeks for it to trickle down into that mental and physical body. And that's why it continued to give longer results compared to the group who just received the SKIO treatment. They got that instantaneous healing, and then it kind of started to fade a little bit. And so it really showed me why it's beautiful when we can incorporate all medicines. It was another validation of that, because you get that instantaneous relief for your patients, as well as then you get that long-term healing. So, but this group had a increase in their motivation by 29%, so a little bit less. I found actually this group, they were very relaxed. And so that didn't necessarily help their motivation the same way the skio group did. But their sleep improved by 43%. Their stress was reduced by 62%, quite substantial. And the pain reduction was 33%. So overall, this group had the largest long-term results. In the placebo group, you can see just alone from the graph, limited results. And so I was expecting them to have some results because, once again, our intention creates quantum collapses. So if somebody comes in and they believe there's a potentiality that they're receiving healing and they're willing to receive that healing, they believe that healing is possible, they've already created a quantum collapse that has allowed them to start healing before I've even done anything on my end. And so I was expecting, I actually had one person in the placebo group whose individual results were incredible. She went from a 8 out of 10 pain from that reading right before her session to that reading right after. She said it was down to a 2.5. She actually described feeling me working on her body despite the fact that she was in the placebo group. She said she could feel energy moving through her in shifts. And what I believe is she so believed in her heart and her body that she was receiving healing, that healing did occur. It wasn't from me, but whether we want to call that from the quantum field, from her soul, whatever language you want to use, some energy came in because she was open to it and willing to receive, and she'd created that collapse. So it was pretty incredible. So a lot of the numbers actually were highly influenced by her in her readings. I did notice though that her results didn't last like aggressively long term. She did quite revert back, but the fact that she was able to create that much healing in that moment for herself was profound to witness. But overall, their sleep showed no improvement at all. Their motivation, it did improve by 17%. Their stress didn't show any improvement, and their pain improved by about 17% for the long-term readings. As far as the short term goes, so this is looking directly before and after. As you can see for the skio group, there was significantly more results than the long term ones directly before and after. So their stress actually dropped about 75% directly after the therapy, which is quite incredible. That's a very large shift. And then as well as an improvement of 25% in their motivation and it was a 50% reduction in their stress and 33% reduction in their pain. And so overall, this was very, very significant compared to the placebo group, as well as even compared to the final results for the skio group. The energy healing therapy, once again, showed a lot of good reduction in pain. Their stress was like, a little bit of a reduction, virtually no improvement in motivation, but almost everybody described after the energy healing therapy feeling a little bit tired, fatigued, or very relaxed. And I think it's because there was more of like a healing process that was happening at a deeper level. Whereas the other one, it's almost like this is my hypothesis, is like the skio is like a battery charger and just charges up your energy field. And so people leave those sessions feeling like they've plugged themselves into the wall and got an extra charge. Whereas the energy healing work, because it's working at that upper layer, it can have almost like a bit of an energetic detox to it, where there's almost a period of fatigue, there's a requirement of rest, and at a time of integration before all the results come in. But still, the reduction of pain by 50%, even just directly after the treatment, is pretty incredible. And the improvement of stress, so the reduction of stress by 25%, is still very, very incredible with that. And it makes sense that you wouldn't be very motivated if you're relaxed and tired. Everyone described wanting to have a nap, so that's probably why. And then this is directly before and after the placebo therapy. Once again, very minimal results were showing. It was about 17% overall again, so 17% improvement in motivation, 17% improvement in stress. And overall for this group, there was virtually no pain improvements. There was only that one lady. She was the only person in the entire placebo group who actually had a reduction in pain. Everyone else said it was about the same, and one person actually said it got worse. So, yeah, you can see in the pain, there's like, she was the one who created the slight little divot there. But it was still very surprising to see how many people said that, oh, they were feeling a little bit more relaxed. And I think what that could have been, my hypothesis of that, is just giving somebody an hour to be conscious, to just be self aware, in itself has its own healing benefits, even without any therapies. And so it goes to show how so much plays into healing. You know, it's not just about the modality or just about the practitioner. There's so much that plays into it. And sometimes when we just give our space just to be conscious and just to be present with ourselves, that it can have a very relaxing effect. And so I feel like that showed in some of the placebo results overall. But the ending results were that the SKIO group had an overall improvement, if we add up all of those numbers together, of 29% from the very beginning to the very end of the study. And then 36% directly before and after the study. So you can see directly it went down a little bit over the month after, but still significant. The energy healing group had an overall improvement of 42% out of every area over the whole course of the study, and only 25% from directly before and after. So you can see the energy healing group actually had more results as time progressed versus the SKIO group went back. And then the placebo group had about 8.5% improvement over the whole study, and about 11.3% from before and directly after the actual allotted time. And so there's, once again, the improvement went down for that one as well. And so, yeah, I feel like as far as that goes, that's my study. I'm not sure if there's much else I want to share with it, other than I just felt that, yeah, it was pretty incredible to be able to witness and to see everything that I know that I'd been working with in my own practice. I've been working in the field of non-local healing for several years now. Definitely is what resonates with me, is that whole concept that, you know, in the quantum field anything's possible. We transcend that law of physicality, and that often we're able to assist people in a new way. And so I find most people who come to me are people who have tried everything and said they feel like they've tried everything, and they're like, this is the last straw, the last thing I'm going to try. Somehow those people are the ones who are always kind of knocking up on my door. But it's beautiful how we're able to help people in that non-locality. But the study itself, to witness how much people's own consciousness has an effect on their healing, how holding space for somebody to be conscious helps with healing, and how just somebody feeling heard or seen or even loved and cared for can create a space of healing before you even before you even do anything. And so to see that in the study results, and to see somebody's ability to heal themselves just through their belief systems, and to have that massive improvement, was a reminder to me of, as practitioners, why it's so important to remember that the healing's not on you. You're here to support and to guide, but ultimately all healing is self-healing. And when we can hold space for people and to love them and to support them, but then to trust them and support them in healing themselves, that's when some of the most profound, deep transitions happen. So yes, that is it. Does anyone have any questions?
I was wondering if you ever thought about doing both simultaneous. I know, obviously, not for this experiment because that would be way too many variables to have to do in your paper. But at
Yeah.
the end of the paper, they ask you what you want to do in the future, and that would be a great way to like extend this experiment a little bit further and see what happens if you do the SKIO with the energetic healing, both non-locality, and see if that kind of like balances out the discrepancies.
That's actually what I do in my clinical practice with my clients. We that's I always do both, and work with my own energy healing abilities as well as with the device, simultaneously interweaving together. And yeah, definitely the results are lasting, and even just supporting people and healing themselves. So kind of holding space for people and walking people through exercises they can do to use their own consciousness to create those quantum collapses. And so that in between our sessions, they're not just waiting for me to come and save them, but then also supporting themselves. And yeah, I noticed the biggest shift in my healing practice when I started putting the healing more in their hands, and I let go of my feeling of responsibility and obligation, that it's like I'm responsible for their healing. If they don't heal, it's because I didn't do something right. And just really let go of all of those self-limiting beliefs I think many of us have, or feelings of guilt if people don't get the results that they wanted or that we wanted to them to have. And just to trust that everybody will find their way in their own time. And if someone's ready for you, then they'll align with you and you'll support them. And if not, then they'll find a different practitioner that maybe will be able to help them with where they're at that time. But definitely, I think combining the two, and then also helping that person do their own supramental meditation, consciousness healing, has really created like profound shifts in people. And I think it's beautiful to witness, because I think a lot of times people don't see it in themselves, but as the practitioner who's seen them, month over month, and just the way they come on the phone call, the way they talk about, how their month went, or, how things are going for them, their perception of the challenges they're dealing with in their life. It's so beautiful to see people shift. So, yeah,
I think that's awesome.
thank you.
Yeah, this was beautiful. I mean, I loved hearing you present it and taking us through your process in the study. Um, yeah, it's beautiful, and it's, to me, this was one of the main studies that really, like, I connected with so much, because it's so much of what I do and how I work with my clients, and so it gave me extra validation, to see it, to see the numbers, to see the differences. It's very, very cool. Yeah. I do have a question about um, feeling into it. So you talked a little bit about how the device goes in and, like, kind of, for lack of a better word, diagnoses where and what needs to be worked on with the client.
Yeah.
What is it? How do you do it? And this is, I'm sure, personal to every healer. I know it is for me, very different every time, but how do you do it where you're going in and kind of like seeing, I'm sorry,
It's okay.
um, seeing what they need, like what's going on, what's their energy asking for?
So in the actual study, I had a specific protocol I followed so that it would be the same for each person. And so basically, I designed the SKIO protocol to be in alignment with following the downward causation model. So I started with auric field clearing and a chakra clearing for about the first 15 minutes. Then I would go into an emotional panel where you could pull up their emotions, do emotional balancing, emotional releasing, and I did about those therapies for about 15 minutes. And then I had a list of therapies that then I would go through in the vital body that would work on the meridian centers, would work on the chakra centers for 15 minutes. And then lastly, I would go in and then do pain, inflammation type therapies. And I followed a structured protocol so that each person was receiving the exact same therapy for the study. I think in my clinical practice, it's very different, but for the study, I just wanted to keep everything very concise. I know with energy healing, it's very hard to create a protocol with an energy healer, because it's like you're in a flow state of some sort. And so it's like, how do you define that? Because it's undefinable. So, essentially the same kind of intention was set to, start at that auric field level, to bring clearing, to bring, white light energy into that space, to purify that level, to come through into the mind space, to clear out cluttered emotions using energy from quantum field. And so the energy practitioner followed that same kind of, I guess, intention, but still it's like it's not as easy as the device. There's specific treatments we went and clicked, but I structured it that way to follow the flow of healing, because I felt that would give the most effective results for that 60 minutes that was allotted for that person.
So,
And
hi, Dr.
yeah.
Yan. I just have to say, you have an exquisite way of presenting the great mystery. And I love how you wove in the principles of quantum physics into the realm of the healer. You did a beautiful job of talking about non-locality and collapsing of the wave. And I really want to support you to get out in the world and talk, because it was beautiful. It was very beautiful. And near and dear was what you said at the end, is ultimately it's really about the self-healing process that we all must do ourselves, which is what my study is all about. Because ultimately I have to be my own practitioner as well. But I could sign up for working with you for sure. Beautiful. Beautiful.
Thank you. Thank you so much. I really appreciate that. And I'd love to, whenever you're sharing it with the world, is to see your presentation or get to take a peek at your thesis then, if that's what it's about, because that was actually my original idea that I didn't follow through with, was similar to that idea. But I'm like, how do I create a study around this? It was that true healing, the solution, or I thought I'd found the key to all healing. And I realized healing isn't one key, but my epiphany was it's awareness. That's all it is. When somebody has awareness, whatever that is, awareness of self, awareness of, their life, the things going on, a deep awareness, the ability to truly witness themselves without judgment, without shame, to acknowledge themselves, healing occurs. Nothing needs to happen except for an acknowledgement. The healing already starts taking place. And that was actually my first epiphany moment. I'm like, the root to all healing is awareness. That's it. That's all it is. And then I'm like, how do I create a study on that? And I shied away from it. But I would be so interested to see your study, because I think that's beautiful. I think that's a part of that self-healing journey, is self-awareness.
Yeah, I was a practitioner for 14 years and loved every single minute of it. And what started to happen, more and more people came to me to have me fix them. And I began to really lose a lot of I guess I would say passion around that. And what became really evident to me was that the healing was, I was just a light for that light to turn on within them. So I became far more interested in, well, how do you turn that light on?
To be a conduit of that support, to hold space for somebody as they become empowered in their own healing. So
yeah, and the resistances that show up to that light. I found some very interesting studies about too much light, not enough light, and how that impacts consciousness. It was pretty fascinating, actually. That was the shock for me.
And do you mean in like the balancing of all parts of ourself, the integration of the whole self?
Yes.
Beautiful. Absolutely beautiful. I feel like that's been a big theme for me recently in my own healing, especially the integration of the divine masculine and feminine, and integration of the shadow body and light body. So.
Yeah, there it is. There it is. I tucked that right in there. Oh, yeah.
Gail and I have been talking about that a lot. Yeah.
So yeah, it's the theme.
We heal unless we are that receptive, patient, calm, beautiful, feminine energy that says, yes, please, yes.
Yeah. And then we also need that masculine to hold that container of strength and power for the feminine to come through. It's that balance of both. And I think so many, especially for women, unconsciously we reject a lot of our divine masculine, or we feel like we have to let it overtake us so that we can be okay in this world, that we can be safe, rather than finding that balance. And I feel like there's a lot of collective healing right now. Like this is like many people, at least in my clinical practice, of yeah, exactly that thing, is finding that healing, that forgiveness of the male energy, so that then it can be integrated and balanced with the female energy within, and can support each other in both power and gentleness, strength and kindness, and like love and compassion, yet action and a progression, all in harmony with each other. So it's so beautiful. I'm excited to see your research and to read more about it, because yeah, that literally just popped into my awareness, I'd say about 2 weeks ago. I'm like, this is what we're focusing on now. I felt a shift that's what is needed for the world right now. So beautiful. Hey, well, does anyone else have any other question?
I wanted you to talk for a second. Oh, okay. Go ahead, Iris. Nope.
No, I would really
Great.
like to know how you use the seal device non-local. It
Yeah.
sounds really interesting how you did that physically.
Yeah, so non-locally, so this is like the way I explain it to my clients, and then I'll kind of explain the science behind it, knowing that the science isn't operating in a unknown. So it's gonna be a little evasive, but there's a little bit of trust that comes into it, and then seeing the results. But how I explain it to my clients is just like what we were talking about, that quantum entanglement. Our intention creates almost like, I call them channels in the quantum field for connection to occur. And so when you create that intention to want to receive healing from the device, and then I create intention through putting in your full name at birth, your birthday, where you were born, those three things are basically the time that your energy, which we know can neither be created nor destroyed, only transferred, that was that exact moment in time and that location under that identification that your energy moved into this reality. And so it's almost like, I call it your phone number. And so it's almost like the device is like, hey, I want to connect with you. And you're like, yeah, I want to receive healing. And then it's almost like picking up that phone, and then the entanglement occurs as if you were here, because we transcend time and space. You can also use a photo of somebody, even if it's just a picture of their skin, and can connect with them that way. I've heard people, which I've never done it this way, you can use a hair strand and you can actually place it on the test tray. I actually have my beautiful baby right here. This is her.
I wanted to know if you put a picture on or if you take a hair or whatever. Yeah.
You can do any of it. I find I do whatever I feel will resonate most with that client, for them to trust the process. And so, for animals, I always do pictures, just because most people don't know their birthdays. Now, most of my clients are I guess we'll say I operate, I'd say, more under spirituality than I do under science. I'm kind of in that area, but I'd say I err more to what we would refer to the spiritual side, since science can't prove the area I'm working in. So most of the people who find me are also very on that side. So they're like, yeah, no, it makes perfect sense. They're like, they don't care. They just trust, and they're very in tune with themselves. And so when they see what's coming up in the device and the accuracy of what's going on, like, oh, it's showing that the energy is reactive throughout your neck. The energy is reactive throughout your lower lumbar. There's reactivity coming up in the energy moving through the liver. And they're like, I have liver problems. I have a spinal injury. It's like it's hard to deny. And then the belief only grows from there, which actually only increases the strength of the entanglement. And I find the first session I do with somebody, they have about what we call 85 to 90% calibration, which means that there's about an 85 to 90% connection with that person. Whereas the more they do the session, sessions, the higher that number is. Like the person I did earlier today, they were 98% on their 5th session with me. And so their calibration's much higher, the more they're able to trust, because we have full autonomy over our energy. And so nothing can be done to you without your permission and without your consent. And so by you wanting the treatment, you're opening it up for then that device to connect with you. But if I try to connect with you without your consent, often it won't work. Either it'll say like can't run testing properly today, or if it goes through, technically your energy field could put a full block up on it and it will just say no, and you won't receive. There needs to be that exchange of consent and desire for healing to occur for it to connect. And so that's how it works. I do really believe, I've actually worked with it in group settings, where what I'll do, like on a Zoom call like this, I'll screenshot a picture of the group, and I'll throw it in to the device and work in people in group settings and do group healing sessions as well. But I truly believe that even if someone wasn't present for the session, and this can be hard for people's mind to wrap around, but let's just say got a recording of it, even though their face wasn't put into it, they can still tune into the vibration and the energy of that session and receive everything as if they were fully present in there. A lot of this is just for our own minds to comprehend. We truly transcend time and space, though. And so it's, although we put that information in and we put the picture in, I think technically we could sit here and I could put no information, and if you've said yes, I'd like to receive healing, it will work on you just through that intention. Yes, we're pretty powerful. Think about the double slit experiment. For me, that is a physical representation of how much our consciousness influences the physical matter of our reality. Waves of possibilities, and all of a sudden you look at something and it collapses based on your projection of what you believe it should do. It shows how our belief systems create our reality. So it's pretty incredible. There's all of those physical representations of how truly powerful our consciousness is.
Amazing. So yeah, the way you're describing everything is so, I just love it. I love listening to you. I feel like that with a lot, there's so many specific women who speak in this way, and I'm just like, oh my God, they're saying what's in here and I don't know how to bring it out. So thank you for putting it into these words.
Thank you.
Yeah.
Thank you so much.
Yeah.
I totally agree. And I'm so using that phone number for description. Because I've had ways too many people ask, and I'm like, well, and then I get scientific, and I'm like, I can see their eyes glaze, and I'm like, okay, but that's perfect.
It's the easiest way for people, and they just get it. Then all of a sudden they get it. I'm like, so if I call you on your phone, is there a cord connecting our phones? It's like, no, but you can still get the call and pick it up. It's a similar concept. There's no cord connecting you to the device, but the device is calling you and you're saying, yeah, I want to receive healing. So you're picking that phone up. And at the end of the session, we just hang up and that's it. So it's, and people are like, oh, that suddenly makes so much sense.
Yeah. Amazing. Yeah. Something you said, it's a whole other, like, we could probably have like a 2-hour, 3-hour discussion about it. But the consent part, that was really powerful statement, what you said about your full autonomy of your energy that we all do. And that's, I'm just gonna make this statement and like put it out there, but it makes me wonder. I've wondered about this for a long time, and I've worked with, people who've gone through childhood trauma. And so that's where I go with that, where I want to have, I guess I want to have more conversations about that with you guys. And maybe that's a whole other like thing that we can do, and we could just chat about it, because that's where yes, we do all have full autonomy of our energy. And what about children? What about people who are abused? What about, just, that's all I'll say about that now.
I want to say,
So
yeah.
honestly, they do. they just forget that they have that ability, and you have to relearn. Like, I suffered trauma when I was really young, like I was molested at 4, and that kind of like was always with me. Like, I had no control over my body and had to go through the steps. I'm still literally going through the steps. Like, I feel like it's going to be till death type of a scenario, but you have to relearn it and keep going over and over again.
I would love to extend that conversation, because one of the things that I've been playing with post thesis is consensus reality. The entrapment of consensus reality is thousands of years of an inheritance of a wrong way of being and thinking, which is aggressive, traumatic, so forth. So Dr. Short, you're just absolutely right on that's the gift that keeps on giving, because it works us and works us. It's like, okay, I'm on the cross. Okay, I'm working that disharmony, and in some beautiful way, I'm changing consensus reality from the old paradigm into the new paradigm. I'm really playing around with that concept too. The notion that we're not responsible to all of the disharmony, or for all the disharmony, but to it in our own challenges.
Actually, a really good book on it. It's called The Body Keeps the Score. And it talks about how physical trauma builds up in different parts of your body, and how there's different ways to kind of release it. And it is an amazing book, but it hurts. But yeah, you could spend all day in that for sure. And you're going to find more women suffer from it than men.
Yeah.
Of course.
For sure. Yeah. And there's specific diseases and illnesses linked to it. 100%. Fibromyalgia, which you were just about to go watch, that's completely connected to it. Fatigue, chronic fatigue, Epstein-Barr, all of those are very much connected to these traumatic experiences.
Absolutely.
I think that's beautiful. And my perspective always comes from the spiritual perspective of that higher level, is that yes, we always at some level are consenting. Maybe even if it's not at that conscious level where we can fathom it in our logical mind, there is always a part of us that is consenting or cannot occur. And I work on children, so I understand that, as I can receive consent from a child, even if it's not from their mouth, even if they can't talk, if they're 1 or 2 years old. It is usually, for me, I'll check if you guys are familiar with like dowsing rods or pendulums, or whatever resonates with you. And I would always ask that child, that soul energy, that supramental higher oneness body, the consent to work on them. And so I think all of our experiences, and this can be a hard thing to fathom at some level, we've chosen for ourselves, for our growth, for our expansion, for our learning, for our healing. Because if we don't experience everything, then how can we truly be whole? And so I think we think that we would only choose good and loving experiences, but at the end of the day, it's not balanced unless we experience both sides of those coins. And so, consent, there's always consent, just maybe not always at that conscious level. Sometimes things happen for our highest good, but I always say you can never really know why something's happening when you're in it. It's when you get to the other side of it, then you look back, that you can see the profound expansion or beauty or growth or learning, the way it shaped you, grew your compassion, your empathy, your inner knowings. And then you look back and you can see it. You can see, okay, you can see that's a part of healing, is seeing the profound divinity in everything, even some of the darkest moments of our life.
Absolutely. Well, I have to sign off, but I want to say thank you. Thank you for an extraordinary hour of healing and camaraderie, womanship. Love being with like-minded, beautiful women, and so I'm going to hold the vision that maybe that we continue this journey of exploration, because it's just beautiful to be with like-minded, hearted beings. Thank you. Thank you for arranging it.
Thank you so much.
Thank you, Gail.
new emergence into the world. Don't hold back. Love you all.
Thank you. Love you. Bye. So I don't know
Amazing.
about all of you guys, but I'm feeling complete too. Unless someone else has anything to ask, I feel like this might be a good note to leave it on and hopefully continue the conversation
Yeah.
again.
I will
Yeah.
say that because it's Mental Health May month,
Oh.
I would highly recommend that you maybe speak out a little bit if you do social media pertaining to that and kind of like let people know about your experiment. And you can use this recording because now you have it and let them know a little bit more info.
Wonderful. Thank you. I appreciate that suggestion and for letting me know because I wasn't aware of that. So good to know.
Yeah, I had no idea.
I'm
Dr.
actually-
G is a good social media person, and she has a lot to teach us.
I am definitely still in the learning phase, but I feel like I will always be, which is a good thing. Green and growing.
Amazing.
Thank you, Hailee.
Amazing.
Great, and especially reminding us. I think that all of us that are here, that we went through some dark parts in our life. Otherwise, we wouldn't be here, and we wouldn't be able to help other people.
Yes.
Yeah, and you, Dr. Hailee, you didn't even share your personal story, but that was really what brought you to deal with all of this and work through all of this.
Yes.
Yeah.
Yes. My personal story just being growing up with anorexia and bulimia, and I was diagnosed with depression, anxiety, borderline personality disorder, a few other psychotic disorders, and yeah, didn't find anything that helped me throughout my teenage life. It was a pretty deep and dark struggle for many years. I almost died a few times. I attempted suicide, I think, about 18 times throughout my teenage years. I was hospitalized twice for organ failure due to malnutrition. And it wasn't until I got into 18, 19 years old that I really, there was like a decision point when it was like, okay, I'm going to stop doing the same things, the traditional therapy standpoints, the traditional medical standpoint, and I'm going to just try something else. I just decided I didn't want to live like that anymore. And it was a long road after that point, but that's when I found energy medicine and biofeedback. And I remember my first biofeedback session, it was actually with a skio. And for the next 2 days after it, it was the first time I ever felt like it myself. It's the best way I can describe it. It was like I was smiling, I was happy, I was singing songs in my car as I was driving. Things didn't feel like the end of the world. And I'm like, that's when I knew. I'm like, I need to get one of these devices. This is where I need to be. This is what I need to be doing. And that was the pivotal point of where I really feel like I started to realize that my illnesses were not who I were, that there was this other person underneath all of that that just wanted to come out, because I started to self-identify with the anger, the resentment, the sadness, the depression. I just thought that was my personality. Like I was just this angry, bitchy, mean, moody child that couldn't get out of it. And it's like all of a sudden I had those 2 days. I'm like, oh my God, there's this other person in here, and how can I help her get out? And it shifted things for me, just knowing she was there and eventually becoming her. Still working on that. It's a process, but yeah. Thank you guys all so much for being here and for holding space and hearing this. It was lovely having you all, and I'm excited to hear and chat with you guys more in the
You did
future.
an amazing job, by the way.
Yeah.
Like hands down. Awesome.
Thank you. Thank you so much.
Yeah, you're natural. Yeah.
I know
Yeah.
I was just like, should I just wing it? I'm like, I didn't know how to prepare for it. And I was like, you know what? I'm just going to go and flow. I'm just going to trust that whatever needs to happen will happen. Usually that's the best way. So
Amazing. Thank you so much.
thank you. You guys all have a wonderful day.
Too. Bye.
Bye, everyone.
Bye.